Welcome to Knowledge on the Go, the podcast brought to you by the PI Programs team at Vizient. I'm Margaret Rudisill, Performance Improvement Program Director here at Vizient, and your host for this podcast. Chronic illnesses present a significant challenge to our healthcare systems, straining resources and impacting patient quality of life. One innovative approach to tackling this issue is the community health worker model, a strategy that empowers individuals to take control of their health and navigate complex healthcare systems more effectively. At the heart of the community health worker model are trusted community members who share the language, culture, and life experiences of the patients they serve. These community health workers play a pivotal role in fostering self-efficacy, helping patients understand their program needs better, and guiding them through the intricacies of the healthcare landscape. Today, we are exploring the creation of the model and how to create sustainability. And joining me to discuss her work on building the community health worker model is Vanessa Saylor, Systems Director of Health Equity at Mainline Health in Philadelphia. Welcome, Vanessa.
Thank you, Margaret.
So, Vanessa, to kick us off, tell us about the moment you realized that a community health worker model could make a significant difference in managing chronic illnesses.
So when I came to the Health Equity Department with Mainline Health in 2022, we were already at the beginning stages of implementing a community health worker model. At that time, we had one staff person, but what was quickly evident was that the community health worker had the opportunity and the visibility with patients to build trust at patient level outside the walls of the hospital and to address gaps that were not an acute care coordination model or even a practice-centered care management model. It was important that we address those needs that patients who come through our doors through the emergency department that may not be attributed to Mainline Health, that they are successfully navigated through a complex system. Community health workers are uniquely positioned to do that.
I agree, Vanessa. When you're creating this model, how did you gain buy-in from stakeholders such as healthcare providers, your executive leaders there at Mainline Health, or funders?
We were very fortunate that the system leadership invested early into this model and funded our core staffing from general operating. From there, we needed to work with different stakeholders throughout the system to find where community health workers could add value to their teams and to show value to patients and making a difference. As we got invited to more conversations and more tables where disparities and ideas to address those disparities were being discussed, we were able to show how community health workers could help address those disparities, gain buy-in from stakeholders, from providers, administrators, funders. It's important to know what's important to the system. What has the system identified that they want to be able to address and have not been able to? How do they close those gaps in care? How do they help patients and community members get through a complex system? When we're sitting down with stakeholders, we're looking for those opportunities to say, that's something a community health worker can address, and here's how we can do that. So when we show value to our stakeholders, we get buy-in.
Right. That's a great approach. What are their needs from the different stakeholders or healthcare providers or administrators or funders? What are they looking for in addressing it from that angle? What were some of the initial challenges you faced when trying to implement the community health worker model, and how did you overcome those?
When we sit at the table, we're getting buy-in and we're showing value. It's a great social care model, but to differentiate a community health worker from care coordination, social work, and to show that benefit can be a challenge in defining who is the community health worker, what is their role. Stakeholders who don't quite understand what their role could be that is different from social work or care coordination or care management. It's a consistent education. It's being with the right people to educate the system on the difference between the community health worker and the social worker, how the two work together seamlessly, community health worker being an outgrowth of the social work model. Our social work model from our original and historical days of being on the ground. Community health workers and social workers are very well aligned. Teaching that does take some time. It's a bit of a challenge, particularly in a healthcare system.
You're right, Vanessa. And I recall during the collaborative that you participated in with us, creating capacity, chronic disease management. It was called Building the Community Health Worker Model. One of the main points out of that collaborative was building trust in the community. And that's a big differentiator when you talk about these challenges. What's the difference in your care management model versus your community health worker? So building trust is crucial. What strategies have you found most effective in fostering trust between the community health worker and the patients?
Consistency is important. Following patients through closing loops. When we engage with patients and we identify the issue or concern that needs to be addressed, and then we address it, certainly fosters trust. They trust that they can bring you this issue, concern, or problem, whether that patient is attributed to your system in a primary care setting or that patient is traveling through. Many patients that we work with are patients who also utilize services from other systems. But we want patients to know when they come through Mainline Health that they are going to access our primary care for specialty care. It's about getting the patient to the right place for the right interventions with the right providers. And when we do that, we do build trust with our community health workers and with our providers. We get patients who need to see many different types of specialists. We make sure that they get where they need to be and offer ourselves, our community health worker team, as that touch point, liaison, support, navigator. To navigate people through a complex health system is underappreciated.
I agree. And the community health worker, once they've built that trust with the patient, can be by their side. What kind of data do you collect and analyze to demonstrate the worth and sustainability of your program?
We collect a few pieces of data. A main piece of data that we collect is our social determinant of health screenings. We screen 4 areas of need: food insecurity, housing, transportation, and financial resource strain. Those are broad categories. Within each of those categories, there's a deeper or layered issue that needs to be addressed. We do try to take patients from assessment to what we call a closed loop, where we measure the need was identified and met. We measure access to primary care physicians and specialty providers, how many of our patients we are actually connecting to care and making sure that they have the right provider managing their care. We measure emergency department utilization. One of our goals is to keep ED visits down so that patients are getting the right care in the right place by the right provider, and the emergency department is not always the best place for that.
Vanessa, I'm sure that does create value for your organization when you're able to share that kind of data with your leaders and providers. I'm sure that is impactful when you're able to show that you've closed the loop like that. What advice would you give to other organizations looking to build a successful community health worker model?
First, you need someone who can lead the work. You need strong, not just executive level buy-in, but you need strong operations. You need someone who understands health systems and can get your community health worker model in front of the folks that need to support that work. I would also advise some type of charter that outlines the work that you will be doing, and that charter should be responsive to whatever the plans are, whatever the priorities are that a health system has established, so that you can show value and how your model will impact those priority areas. Leadership from the top, from the operations side, a clear vision and clear path for the work. These are things that will jumpstart your program.
Well, thank you, Vanessa, for sharing your insights about creating the community health worker model. And thanks to you for listening. For Vizient's PI Programs team, I'm Margaret Rudisill. Please join us for more Knowledge on the Go podcasts. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com. Have a great day.